All right, come here. Listen to this. Listen to this real quick. Did you hear that? That little click? What that is the sound of quality of life if you're a patient that's struggling with your denture, or you know somebody that's struggling with their denture. Now, if you don't wear a denture, if you're not headed towards a denture, you can probably pass over this video, look over this. But if you do wear a denture and you struggle with it at all, or you have a loved one that does, listen up, because I'm going to try and share a couple of the reasons why so many patients with a lower denture struggle with it, and they can be, well, just a big impediment to a good quality of life. I mean, all of us like to chew, all of us like to eat, and sometimes a lower denture can be a massive impediment towards us enjoying the food that we eat and just having good quality of life because of it. So let's talk about this. Why do lower dentures, why are they so terrible so often? Well, to start with, when we're dealing with an upper denture, we don't have near as much in the way. But this is the form of somebody's lower jaw here, and usually what sits right in here, well, it's the tongue. The tongue sits in here, and we don't have a lot of ridge to take and rest a denture on. This tongue is in the way, moving around, and when the tongue moves, all of our attachment around here moves and wants to push that denture up. So it just doesn't rest on as much. Whereas for a lot of you that have an upper denture, most of our denture patients are a lot happier with their upper dentures than they are their lower dentures. And we see that all the time. So usually, in fact, we know that lower dentures are bad enough that oftentimes when we do a lower denture, we really work hard to undersell them. And usually I promise our patients that they're not going to like their lower denture. And that's just because we don't have as much to hang on to. Now, and this varies also, because some patients, where their gums will come in here and attach, some of them attach really low where we've got a lot of bone to hang on to. Some people that come in and it's all the way down here. Also, when you get your teeth taken out, over the course of years, the bone here is going to slowly decrease and resorb year after year as you lose bone. So without having teeth in place to keep the bone, the bone tends to resorb and disappear over time. So all of that adds up to, you try and put this denture in your mouth, and it's moving and sliding around in there. It's really hard to keep in place. And when you try and bite down with any pressure, it's causing so much movement you can't bite down with any force. But what we found is, I mean, dental implants can replace teeth in a lot of different ways. One of the most powerful ways is with a denture patient. And even something as little as putting 2 dental implants here. And in this case, you can see a clear cutout where what we have is a dental implant that's been placed where your tooth used to be. So we put that dental implant in there, and that now gives us something that, instead of the denture just resting and sliding all around here, you just take, and when you put it in your mouth, you clip in. And now, when you're biting down, with just 2, it can rock and move a little bit. When you bite down, it's not moving very much. And you can bite down with so much more force, so much more pressure. We found that, I mean, patients can chew 3-4 times as well just by putting 2 implants in their lower often. So this is a huge quality of life change for a lot of our patients, and a really big bang for the buck in terms of what patients do. Now, of course, you can keep going with implants. I mean, you can do 4 implants and then it's locked down really good. You can do implants on your upper, and you don't even have to have a denture. I mean, we can take it that far. But in terms of just being something that's budget friendly and having a huge impact on quality of life, if you suffer with your lower denture, if it's not staying in place, or you know somebody that's just really struggling, I mean, we're talking about a big deal here, because, I mean, think about how much that you not chewing, not being able to enjoy your meals affects your quality of life. It's not a small thing. And so this is something that has really made a lot of our patients' lives better. So now, if you were looking to find out more about this procedure, easiest thing is to come in for a consultation with us. So that's something that you can do. Come in free of charge for a consultation. Just mention this ad that you saw this, and when you call in, and they'll set you up for a free consultation to talk about these with one of our dentists here at Las Cruces Dental Solutions. Now, when you proceed to get the implants here, so just realize we place all of these in a very modern fashion. So we use computer-guided surgery with 3D guides. It makes things a lot more comfortable. Not nearly, it's like the laparoscopic version of getting a dental implant. It's a really nice way to do it and has higher success rates. So not only are we going to do it in a modern way, but the end result, if you're looking to get something like this, can be life-changing. So If you have any extra questions about this, want to find out more about it, just give us a call. There'll be a link around this video somewhere. Worst case, look us up at Las Cruces Dental Solutions and just get in on a free consultation, and we can discuss locking that denture down a little bit better for you.